Hello everyone and welcome to another video. Tonight we're going to be talking about the problem with public-private partnerships, or PPP. I noticed a trend as I was reading the news about many public hospitals and other projects that seem to go over budget. So I thought I'd consider for a moment about the difference between a government building a hospital versus, say, the private sector building a hospital in a place like the United States, for example. So I put together some research and I'm just going to share it with you today, and I call it the problem with public-private partnerships. The news media has had a field day reporting on all the bungles tying up the new Perth Children's Hospital. The new hospital's gone well over budget, found asbestos in some of the building materials, and had lead in the water. The hospital is finally complete, but John Holland is ready to take the scalpel to the public purse by pursuing legal action against the state government of Western Australia, i.e., the taxpayers who will foot the bill should a judge rule in their favor. As a conscious taxpayer, I find it appalling that a company can pursue such action after severe underperformance in building the hospital. It appears we will be rewarding incompetence rather than punishing it. The total cost of the new Perth Children's Hospital at this point in time is 1.2 billion Australian dollars, and that is before taking into consideration the lawsuit brought forward by John Holland. Both John Holland and the state government are suing for damages, with John Holland pursuing $300 million after refusing to settle with the government for $20 million outside of court. To be fair to John Holland, their claim is that significant changes were made to the project that hadn't been laid out in the initial planning stages. The state treasurer was quite visibly shaken about the action taken by John Holland from the report by the ABC, so we'll see how this plays out. The cost blowouts and bungles of the Perth Children's Hospital happened at a Royal Adelaide Hospital as well. The total cost of the project was supposed to be $2 billion plus $245 million for medical equipment. The South Australian government had to pay out a consortium contracted to build the hospital $34.3 million to settle a dispute. The Royal Adelaide Hospital is the most expensive building in Australia and is the 17th most expensive building in the world. There are mostly commercial enterprises that trump the Royal Adelaide Hospital, but it's not the most expensive hospital. Sweden tops the list at number 3, with the Nya Karolinska Hospital at a cost of $6 billion US. The new university hospital in Sweden has also been met with criticism. One article described how the new hospital will have fewer beds in an already oppressed system. There have also been reports that the company hired to build and maintain the hospital in a public-private partnership created a new tax identity to funnel money into Luxembourg to not get slugged as hard in Sweden. You may not be surprised to find that auditors cum management consultants PricewaterhouseCoopers, or PwC, were hired to create a tax structure that would facilitate the funneling to Luxembourg. The professional services company has been known to help large corporations avoid taxes. The company received $55 million from Caterpillar, for example, to develop a tax avoidance scheme by funneling money to Switzerland from the US. Over a 10-year period, Caterpillar was able to avoid $2.4 billion in taxes. Once again, probably legal, but questionable ethically. The last hospital I want to look at is a children's hospital in Dublin, which is said to be the most expensive children's hospital in the world at a cost of 1 billion euros. Can you guess what the original budget was? The original budget for this children's hospital in 2012 was 404 million euros. The more I read, the more I keep seeing different figures, but this latest says the cost would blow out to over 2 billion euros. One of the more unfortunate events didn't involve construction of the new hospital, but in the naming of the building. The original name was Phoenix Children's Hospital. The problem with that name is it is the same name as the Phoenix Children's Hospital in Arizona in the United States. The hospital in the US threatened illegal action, and the name was eventually abandoned, but not before spending 40,000 euros on it. The Minister for Health, Simon Harris, also came under scrutiny for how he handled the situation, saying he was unaware of the cost blowouts in November when he had received correspondence in August. Now we have 4 examples here of government projects mired by controversy, corruption, cost blowouts, and other issues. It seems that the most lucrative contract for a construction company is the public hospital. Not only do you get to build the hospital, but PPP partners also get the advantage of ongoing income from maintaining the hospital, as is the case with the Royal Adelaide Hospital and the hospital in Sweden. That is, of course, after taking advantage of the government money you just received by channeling it to tax havens. When you have the private sector versus public sector doing business together, my money will almost always be on the private sector to be surgically precise in extracting as much from the project as possible. What can a government do? Can they put a stop to the project? I think not. Except there is a case that I noticed recently in Sydney where the government was able to scrap a contractor for not meeting up to the deadline requirements, so it is possible. But from my research thus far, it's not common. The new super hospital in Sweden was built by a Swedish hospital group, which is owned by Skanska and Innisfree. Skanska alone has a history of poor business dealings, such as their Malta hospital, where they used low grade cement for use on paving, which led to tremendous issues with the hospital and to safely installing a helipad there. 6 former Skanska managers were arrested for tax evasion relating to dodgy business dealings in South America. I don't think we can be totally surprised to find dodgy business dealings on this project when the instances of corruption are so widely available to the public. Part of the motivation to engage in such partnerships is to distribute the risk more equally. The partnerships can at times last for decades after construction is complete, as the contractor will assume a maintenance role within the public infrastructure. The PPP system is not without problems. Due to some of the projects being so large and costly, there are only a few organizations that will be able to deliver on such a project. We have the smartest guys in the room negotiating with health ministers and the government. We have a lack of competition. We have management consultants organizing tax avoidance schemes for funds for government projects. If there is any competition in this, I would say it is between the private firms and the government is losing. There's been some research done on the effectiveness of these public-private partnerships, and the results appear to be mixed. One study compared traditional funding models, those where the government fulfills the ongoing maintenance role, to the new PPP funding models for projects like healthcare, transport, etc. Public-private partnerships seem to outperform on metrics such as getting closer to the expected cost of a project than traditional funding models. PPP also had an average cost escalation of 4.3% as opposed to the traditional projects, which had an average of 18%. A last point on the comparison between these models, I'll quote directly from the paper that says, "Over the period from initial announcement of a project to when it is finally commissioned, Triple Ps and traditional projects are delivered with the same confidence in the likely overall time performance." Close quote. The more I study on this, I can see the traces of PwC sprinkled here and there. Researchers in a study criticizing the PPP system linked to studies by PwC spruiking the PPP model that they've benefited from in the case of the Swedish hospital. Their hypocrisy is on full display when they seem to show support and sympathy for public funds. Their response to the criticism that Triple Ps are used to transfer public funds into private hands is that, quote, "private organizations must show responsible behavior." PwC did exactly the opposite with Swedish funds by creating the scheme to reduce the tax liability with the Swedish hospital to Luxembourg. Now let's dig into some criticism of the Triple P system. Demi Chung noted one of the appeals of this model, and it stems from an assumption that the private sector is more equipped to handle massive construction projects more efficiently. But it doesn't appear to be clear that the private sector in the context of a public hospital project is delivering on their reputation for efficiency and cost reduction. I would argue that the setting of a public hospital is not one that is conducive to efficiencies because it is not operating in an environment of competition. I'll provide an example of a competitive healthcare market later. One study highlights a few reasons why the promises of the Triple P are not easy to determine if they are worthwhile. It says, quote, "Handing over control of service delivery to the private sector is difficult to monitor and evaluate. Carries cost implications which remain largely unquantified and can create additional risk." Close quote. As optimistic as PwC is about the model, I don't think it is as straightforward as is presented by groups set to profit from them. The case study looks at health infrastructure in 3 countries, Spain, Portugal, and Australia. In the case of Spain, there were issues with contract negotiation. The first contract was bungled, and the government had to pay compensation to the private company for lost profits. There were also issues particular to Spain where the private company had holdings from local banks where politicians could potentially have an influence on the whole process, basically implying opportunity for corruption to present themselves. Portugal's problems involved contract negotiation. In Australia, the issue was with cost blowouts, contract issues, and failure of private companies to provide services due to an underestimation of costs. One instance saw the government having to resume control of services from a private operator and remove a provision in future PPP contracts for clinical services. The state government of Victoria seems to have figured it out and doesn't want to get taken for a ride anymore. Now, I originally set out to determine if the cost to build a hospital in the United States, where health services are provided by the private sector, is more expensive or less expensive than the countries where healthcare is provided by the public sector through PPP models. What I found on my way is a pattern of PPP projects of cost blowouts, contract issues, corruption, or at least the potential for corruption, and bungled projects. Much of what I've described as the funneling of public funds I'm sure is legal, but we should be questioning the ethics of these projects. I will provide one example of the most expensive hospital in the United States to provide a contrast between what's happening in a place like the United States versus places where the government is largely involved in healthcare. So the example is from Paula and Rusty Walter Tower in Houston, Texas, and it cost a total of $697 million. The hospital is much smaller than Australia's Royal Adelaide Hospital at 390 beds versus 800. There are more than 85 hospitals in the Houston area alone, some that are for-profit and others that are non-profit. The hospitals service a population of 2.3 million. Adelaide in South Australia has 23 private hospitals and 22 public hospital services, servicing a population of 1.27 million. One difference between the most expensive hospital in the world in Adelaide and the most expensive hospital in Houston, Texas, is a private donor gave $101 million towards funding for the new medical tower at Houston Methodist Hospital. The hospital also declares that they have customers that come from all over the world to seek treatment. Another notable difference, suggesting a high-quality service. Governments appear to be trying to reap the benefits of market-based healthcare in building construction and long-term services like we see in the United States. But in the absence of a market like we see in Houston, of both for-profit and non-profit hospitals as far as I can tell, the governments are being taken for a ride, and taxpayers are not getting value for their money. Meanwhile, in America, funds are gathered from multiple sources, including private donors. It appears the capitalists, which I'm sure receive some kind of tax credit for their charity, are willing to donate funds to support the health care of people. The Houston Methodist Hospital also outlines the way it is able to provide care for those regardless of their ability to pay, and the policy appears to be quite sensible. These findings hopefully provide some insight into different healthcare systems. I don't think it is as simple as saying one system is better than the other. There are many challenges to these projects due to their scope and magnitude, but I think it's important to consider the differences between healthcare in the United States versus healthcare in other parts of the world. In the United States, the most expensive hospital was $600 or so million, contrasted to the billions that are spent in other places. It will be an ongoing challenge for governments to provide health services and finding the best way to work with the private sector to deliver health care. The advantages of governments are expecting from the private sector are not being delivered, and we should not be surprised considering the market conditions that fuel those efficiencies do not exist in many of these massive hospital construction projects. That's it for today's video. Hopefully you've enjoyed it. Let's have a chat about healthcare. Let's talk about the economy. Let's talk about the differences between a government building a hospital versus the private sector. What do you know? What have you seen? Let's have a discussion about it, and I'll see you next time. Thanks.